We are here today to just give you some very brief information for new moms, for expecting moms and their significant others and families. Currently, due to the fact that the entire nation is under kind of some new rules and we're being very cautious with social distancing, our system is currently not offering prenatal classes, which we normally would offer to our prospective patients. So we're here today just to give you some very, very brief information, just to kind of prepare you for what to expect when you come to our facility to deliver your new baby. I'm going to talk with you today just about some things that you may experience, or just to give you some brief information about what to expect if you come to our facility as an expecting mom. Here at our facility, if you are greater than 20 weeks gestation and you come in with some type of complaint that could be labor related, such as swelling, headaches, back pain, you think you're having contractions, maybe you're leaking fluid, you're not sure if your water's broke, all those patients will report to the emergency room. You will see an emergency room nurse who will do a quick triage, just some vital signs and some very quick information from you. And then the emergency room staff will call here to labor and delivery, and they will give us a brief report, and they'll bring you up to our unit, and you'll go to what's called the evaluation room. When you get there, typically we're going to put you on the electronic fetal monitoring, where we'll monitor your baby's heart rate as well as your abdomen to see if you're having any contractions. Sometimes we may get a urine sample from you if that's typically the doctor's preference. We'll get vital signs, ask you a complete medical history, as well as just a brief story about kind of what's going on, what brought you into the hospital today. After we get all that information, we're going to call your physician, tell him what's going on, relay all that information that you gave to us, and then he'll let us know what he wants to do. He gives us physician's orders, and then we carry those orders out. Those orders can be a very big range of different things to be done. Some patients will just stay with us for an hour and we'll continue to monitor you and recheck your cervix and see if your cervix is dilated. Sometimes you may get an IV, you may get different types of medications. Sometimes if your water's broke or if you're contracting and your cervix is dilated, then at that point the doctor will give us the orders and we'll actually admit you to our labor unit. This unit is a locked unit. It's a 10-bed LDRP. That means labor, delivery, recovery, postpartum. So this unit's designed for you to do everything here in our department. You'll labor in the room, you'll deliver there, and you'll go through your recovery and your postpartum phase. We are a locked unit. Therefore, we do not have, even in general times, outside of the COVID deal, we do not have open visiting. So people who can't just come into our unit, walk around and look and see what's going on, they have to be here to see a specific patient. So it is locked, and that's to protect you as well as for the privacy and the protection of your baby. So that's what will happen if you come into the hospital with some type of complaints. There are certain reasons that would be important for you to come to the hospital. If you're leaking fluid, you're not sure, I don't know, did my water break or did I pee on myself? I'm not sure. You should always come in to be evaluated. If you're at home having stomach pain or back pain that you think could be contractions, if you're having contractions every 5 minutes and that's been going on for at least an hour, you need to come in to be evaluated. If you haven't felt your baby move, that's a big deal. Like, we want babies to be nice and good and active. So if you're at home and you're like, I just don't know if I have felt my baby move today, always that's going to be a reportable condition, either to your physician or you come to the emergency room to be evaluated. If after speaking to your physician, he decides that you need to be admitted, if you're in labor and we're going to admit you to our department, we move you to one of our labor and delivery rooms. After you're admitted, typically all patients are going to get at least an IV. That's going to give us IV access. In the event that during your labor process you're going to need some medication or we have an emergency, you at least have to have IV access. Most patients will get an IV. We'll draw blood work. All patients gets lab work drawn. We'll hook you up to some IV fluids. Those IV fluids help keep you hydrated during the labor process. Some physicians will want to do what's called an augmentation of your labor. Therefore, we'll start you on some medication. Typically, it's something called Pitocin, and that's going to help you have more regular and stronger contractions. At some point during the labor process, you may be in pain and you need some pain relief. There are different options. Some patients choose to just have what's called IV analgesia. That's a type of medication that we just put in through your IV that will allow you to have pain relief. A lot of patients will choose to have what's called an epidural. That's a special type of anesthesia that an anesthesiologist will come to our department. He actually places an epidural needle into your back, places an epidural catheter. That's a special little tube about the size of some fishing line. It goes into your back and it's hooked to a pump, and that pump runs continuously with some special medicine very similar to like the medicine that will numb your face if you have to have dental work done, and it runs on a pump continuously until you have your baby, and that will give you pain relief during the labor process. Some patients choose not to have any type of pain medication. There are other options that we can do to try to help with pain relief, like cold therapy or heat therapy. We have things called K-pads. Those give warm, moist heat that can help with like low back pain. Just position changes can help with pain relief during labor. Here in our facility, we have something called wireless monitoring. It's a special little probe or a special little pad that goes onto your abdomen, and it allows you to get up and move around during the labor process, but still allows us to monitor your baby's heart rate as well as your uterus for contractions. And that will give you more movement so that you can move around. You could sit on a birthing ball, you could sit in the rocking chair. Sometimes just different movement helps people with their pain control. So those are some other options that we could do for pain relief during labor. While you're here in our department in labor, the physician, your physician, is not always here with you. Sometimes they may be at their office if it's during the week. They may be at home, which may only be a few minutes down the road from the hospital. They're not always here. The nursing staff is here with you during the entire labor process, and once you get to the point where it's time for your baby to be born, then we'll call your physician and they come here to the facility, and they're on the unit waiting for the time that your baby's going to be born. Once when we get ready to start pushing to have your baby, we will limit visitors. Currently, our process is we only have 2 people present during labor. Outside of this COVID virus, we normally would allow 3 patients during the labor process. Once your baby is delivered, we like your baby to go skin to skin with you right on your chest. We recognize what's called the golden hour. We want your baby skin to skin with you for at least the first hour or until the baby breastfeeds, if you're going to breastfeed, for immediately after delivery. During that time, we really want you and your baby to stay close together with maybe just one person with you, your significant other, your mother, your sister, whoever that most immediate support person is, and they're going to stay with you during that golden hour of recovery. At the time when it's time for your baby to be born, not only will your nurse who's taking care of you be present, but also your physician. He or she will be there too to attend your delivery, as well as what's called an OB tech. That's a technician who works here in our labor unit who gives the nursing staff some additional help at the delivery. You will also have a nursery nurse. That's a nurse who's dedicated only to taking care of your baby once the baby's born.